Good day, I am Fredalyn Joy Castro from BSN 28 and today I will be present the drug literature of butamirate, citrate or Sinicod forte. Sinicod forte is the brand name from the GSK or British multinational pharmaceutical and biotechnology company, while butamirate citrate is the generic name. It has its same chemical substances as Sinicod forte. Sinicod forte is an antitussive drug that is used to treat symptomatic cough of various origins. Peripherally acting antitussive acts on the local nerve endings, causing an anesthetizing effect. It also has a soothing effect to the patient's throat, while centrally active antitussive acts on the cough center of the brain located in the medulla oblongata of the brainstem, which in turn weakens the cough reflex and elevates the coughing threshold. Since antitussive have depressing and generalizing effects, patients with head injury or central nervous system disorder is cautioned to take antitussive. Contraindications for pregnant and breastfeeding mothers. They are not allowed to take butamirate for this drug can cross the placenta and secreted together with breast milk. You should only take butamirate during the second or third trimester of pregnancy if your doctor has advised you to do so. For patients with allergy to butamirate, consult your doctor before taking butamirate as medication. Also, patients with a history of narcotic addiction are cautioned in taking antitussive for some types have components that can induce addiction. For patients with asthma and emphysema, it is contraindicated because inhibiting the cough reflex would lead for the pooling of respiratory secretion and losing of respiratory reserve. Side effects. Like all medicines, these medicines can also cause side effects like somnolence or feeling of drowsiness, itchy skin, rashes, nausea, diarrhea, and low blood pressure. It can also influence the ability to drive and use machines because of the sedative and drowsiness effect of antitussive. Caution should be observed for a patient that needs to be alert. If adverse effects are occur, consult to your doctor. Interaction. Avoid taking simultaneously other cough medicines because it may lead to accumulation of bronchial secretion in your lungs. Tell the doctor or pharmacist before use if patient is taking or have recently taken or any regular medication on prescription or over-the-counter products. Dosage. For syrup, each teaspoonful or 5 ml contains 7.5 mg of butamirate citrate. For tablet, each sustained-release film-coated tablet contains 50 mg of butamirate citrate. Administration. For syrup, children 3 to 6 years of age are advised to take 1 teaspoonful or 5 ml for 3 times a day. For tablet, adolescents over 12 years of age are advised to take 1 tablet twice daily to be swallowed whole. Excipients with known effect. Excipients are inactive ingredient in the medication. This medicine contains 284 mg of sorbitol in each ml. Sorbitol is a source of fructose if the patient has an intolerance to some sugars or if patient has been diagnosed with hereditary fructose intolerance or HIF, a rare genetic disorder in which a person cannot break down fructose. Talk to the doctor before taking or receiving this medicine. If the patient has intolerance to some sugars, contact the doctor before taking this medicinal product as it contains lactose monohydrate. This medicinal product contains small amount of ethanol or alcohol, less than 100 mg per dose. Nursing intervention or consideration. Assess the patients for signs and symptoms of excessive cough, common colds, or respiratory tract condition to confirm the indication for administering antitussive. Then check the patient's allergy status. Alternative to antitussive should therefore be considered in case of allergy. Check for current medication that include monoamine oxidase inhibitor, as this should not be used with antitussive. Monoamine oxidase inhibitors are not recommended to be used alongside with antitussive as the interaction may result in decreased blood pressure level or hypotension, nausea, fever, or coma. Then educate the patient about the action, indication, common side effects, and adverse reaction to note when taking antitussive. Instruct the patient on how to self-administer antitussive. To inform the patient on the basic of antitussive as well as to empower him or her to safely administer the medication. Monitor the patient response to antitussive to check if the antitussive are effective or if the dose needs to be adjusted. Then check the 12 rights of medication administration before administering medication. An evidence-based review of antitussive herbs containing essential oils in traditional Persian medicine. Cough is one of the most common medical symptoms for which medical advice is sought. Although cough is a protective reflex responsible for clearing the airways from secretions and foreign bodies, it can be a troublesome symptom that can cause discomfort to patient. Due to the increasing interest in herbal remedies in both developed and developing countries, in this study aimed to review over medicinal herb containing essential oil used as antitussive agent according to traditional Persian medicine textbooks. 49 herbs containing essential oils have been recommended in traditional Persian medicine textbook for the treatment of cough. 21 of them had at least one known mechanism of action for cough suppression in the scientific literature. Most of the cited medicinal plants were assessed for neither citric oxide inhibitory or antitussive or expectorant activities.